What we call genius is often just patience married to method. A pencil moves across paper, sketching a tiny heart. One artery to another, a borrowed river of blood. Below the gallery, an operating room glows. In the seats above, a small woman with an oversized stethoscope watches every hand and stitch. She can't hear the monitors clearly, so she reads lips and posture and listens with her fingertips. A child on the table turns blue when she cries. The drawing on the paper is not art, it's a detour. If it works, blue becomes pink. Her name is Helen Taussig, and her story doesn't begin in the operating theater. It begins in Cambridge, where books are both companions and opponents. Dyslexia makes letters waver. As she steadies them with stubborn effort. Later, when her hearing dims, she doesn't step back, she leans in. She finds an amplified stethoscope, learns to read lips, and trains her fingers to feel murmurs the way a violinist senses a string's vibration. Listening becomes a full-body discipline. That discipline carries her to Johns Hopkins. In the Harriet Lane Clinic, the babies who arrive are not postcard perfect. Their hearts have learned the wrong geometry in the dark. She refuses to call this fate. She calls it flow, and she begins to map a tetralogy of phalate, transposition, pulmonary atresia, a river that never quite reaches the sea. The more she looks, the clearer a question becomes. If blood isn't reaching the lungs, can we borrow a little from a nearby artery and send it there? That question draws a line from the clinic to the lab. The subclavian artery feeds the arm. Pulmonary artery feeds the lungs. What if a careful connection between them could carry enough oxygen to the brain to buy time for growth? Ideas by themselves are lightning from the outside and quiet accumulation from the inside. To turn this line into a life, Taussig needs hands that invent as fluently as they heal. Upstairs she finds them, Alfred Blalock, the new chief of surgery with institutional gravity, and Vivien Thomas, a master craftsman of living systems, whose bench is crowded with instruments he designed himself. In the lab, Thomas refines the technique clamps that won't tear baby vessels. Angles that keep a suture from narrowing the flow. A sequence that lets a fragile bridge hold. Practice becomes choreography. When the day comes, the room tightens, but does not freeze. Blalock operates. Thomas stands at his shoulder, coaching the angles only experience can see. Taussig reads the room from above like a conductor reading a score. Clamp, stitch, breathe. Then slowly the color shifts blue, retreating. Pink arriving less like a miracle than like dawn persuading a room to stop, pretending it's night. The world will call the operation the Blalock-Taussig shunt. Families bring hope folded into coats. Childhoods once cut short begin to stretch. What does this teach beyond medicine? First, learn to reroute the river. When something vital in your work is starved in idea without oxygen, a team without resources don't blame the weather. Draw the flow. Where does value pool? Where does it vanish? Then build a small, durable bridge to carry what's idle to where it matters. A standing check-in. Between teams that never speak. A scholarship that removes the first barrier, rather than the 15th NAPI that lets knowledge cross islands. Done lazily, detours are hacks. Done precisely, they are lifelines for the season you're in. Second, share credit so the field can grow. Stories slide towards single heroes. Accuracy pulls them back. Taussig brought the clinical problem and the physiological fix. Blalock brought surgical leadership and the platform to spread it. Vivien Thomas turned drawings into living technique, designed tools, and trained a generation with his hands. For too long, his name sat at the edge because of the color of his skin and the shape of his title. Taussig used her voice to move him to the center where he belonged. Excellence is technique plus ethics, and the work lasts when the credit is true. Third, move at moral speed. Not long after the shunt begins saving lives. A sedative promises relief in pregnancy and delivers catastrophe abroad. Babies born with malformed limbs. Taussig studies the pattern, speaks with clinicians, and returns home alarmed. In the United States, FDA reviewer Francis Kelsey withstands pressure and refuses approval. Taussig adds a respected voice to the warning, writes plainly, and helps shift policy towards stricter evidence, especially when the vulnerable are at stake. The lesson is not fear, it is pace. Move fast where courage is owed. Slow down where certainty is owed. Write speed limits into your road before urgency lies to you about what matters most. Threaded through all of this is a way of being. Taussig listens with her whole body. She draws until mystery becomes a map. She surrounds herself with people whose hands are better than titles. She presses the accelerator when a child needs oxygen and the brake when a nation needs caution. Her clinic walls hold children's drawings because follow-up is love in a professional dialect. Her bench holds custom clamps because ideas require tools. Her lectern at the American Heart Association holds a voice made clear by the necessity of speaking carefully when it counts. So bring this home. Map your own flow product, classroom, team. Build one careful bridge where value stars. Say names out loud that history tends to erase. Teach the method so others can repeat it, and set the brakes where speed would break what matters. The good physician treats the disease, as the great physician treats the patient who has the disease. Helen B. Taussig treated the child and the system at once. She showed how quiet craft changes outcomes for thousands, how honest credit expands a field, and how ethics and speed can share the same room. Reroute the river. Credit the hands. Set moral speed limits. Then go do your work like someone's life depends on it because, in ways you may never see, it just might.